Friends, in this video we are going to discuss the important spotters in head and neck. Actually, this is the last session of head and neck spotters. Okay, so let's move to the first question. Any idea about the structure pinned here? Yes, the pinned structure here is tubal elevation. Tubal elevation. Okay, so in the last specimen we have pinned this area, we have probed this area called as tubal opening. That is the opening of auditory tube or eustachian tube, isn't it? So just behind the tubal opening, we have one elevation which is pinned in this specimen, right? Called as tubal elevation. And the sub-question will be how it is formed, how the pinned structure is formed. Any idea? Yes, the tubal elevation is formed by the collections of lymphoid tissue. Okay, collections of lymphoid tissue known as tubal tonsils. Okay, tubal tonsils. So tubal opening is surrounded by collections of lymphoid tissue or lymphoid follicles called as tubal tonsils. Okay, fine. Let's move to the next specimen spotter question. Any idea about the pinned structure here? Yes, this is the nasal septum. Okay, the pinned structure in this specimen is nasal septum. Fine. I hope you will be knowing both the right and left nasal cavities are separated by one midline partition called as nasal septum. Okay, so the sub-question for the nasal septum may be formation of the pinned structure or blood supply of the pinned structure, nerve supply of the pinned structure, or applied aspect. Any one among these four may be a sub-question. Okay, and please remember the nasal septum is an important theory short notes, 5-mark question. So let's talk about the details of the nasal septum. Fine. So in this diagram, okay, you are able to see the three main bones forming the nasal septum, which have been numbered as 1, 2, and 3. Okay, so what are the three main structures forming the nasal septum? Anteriorly, the nasal septum is formed by septal cartilage. Okay, and posteriorly, there are two main bones forming the nasal septum. Posterior-superiorly, we have perpendicular plate of ethmoid bone. Okay, posterior-inferiorly, we have nasal septum formed by one bone called as vomer bone. Okay, so that's what I have written here. The three main structures forming the nasal septum. Fine. Okay, now let's talk about the minor contribution for the nasal septum. Just now I told the three main structures forming the nasal septum, right? Now we are going to talk about the 4 or 5 minor contribution for the nasal septum. Okay, so whatever the bones which are located nearby the nasal septum, they will be contributing a little bit for the nasal septum formation, like frontal bone, nasal bones, then maxilla bone, then palatine bone, and sphenoid bone. Okay, so the crust means small elevation. So the crust of nasal bone, frontal bone, crust of maxilla, crust of palatine bone, and if you want, you can include one more, that is a rostrum of sphenoid bone. So these are the 4 or 5 minor contribution for the nasal septum. Fine. So if you want, you can remember as 4 known, FN, 4 known, PM. Okay. The minor contribution: frontal bone, nasal bone, palatine bone, and the maxilla bone. Okay. They are minor contribution for the nasal septum. Yes. Okay, so I hope you are clear about the formation of nasal septum. Now let me talk about the blood supply of the nasal septum, that is arterial supply of the nasal septum. Okay, so totally we have 5 arteries supplying the nasal septum. The 5 arteries can be remembered by this mnemonic: gaps, GAP, gap, yes, gaps. Okay, so greater palatine artery, sphenopalatine artery, greater palatine artery, sphenopalatine artery. Then AP representing anterior and posterior ethmoidal arteries. Fine. And one more S is representing the superior labial artery, actually, which is a branch of facial artery. Fine. So These are the 5 arteries supplying the nasal septum. Okay, septal branches of these 5 arteries: greater palatine, sphenopalatine, then anterior and posterior ethmoidal arteries, and superior labial branch of facial artery. Okay, so these are the 5 arteries supplying the nasal septum. Fine. And one more important topic related to the nasal septum is little's area. Little's area. So you can see in this diagram, you can understand which is anterior, posterior, superior, inferior for this diagram, right? Orientation, right? So in the antero-inferior part of the nasal septum, antero-inferior part of the nasal septum, we have one particular region named as little's area. So what is the location of the little's area? It is located in the antero-inferior part of the nasal septum. And what is the importance of little's area? It is the site of rich arterial supply. Okay. So there is one arterial anastomosis formed at the little's area, which is named as Kieselbach's plexus. So what is Kieselbach's plexus? It is the anastomosis formed by the arteries at the little's area. It is an arterial anastomosis. Okay. Earlier, I have told you there are 5 arteries supplying the nasal septum, right? Out of this 5 arteries supplying the nasal septum, okay, except P, the remaining 4 arteries, namely greater palatine, sphenopalatine, then anterior ethmoidal and superior labial. Okay, these 4 arteries, they take part in the arterial anastomosis called as Kieselbach's plexus, which is located at the so-called little's area. Okay, so this may be a MCQ question. All the following arteries are forming the Kieselbach's plexus except. In the exception, you will have posterior ethmoidal artery. You can see in the diagram. Okay, you can easily appreciate posterior ethmoidal artery is not taking part in the little's area, that is Kieselbach's plexus. Fine. Okay. Now, so this is what I have talked about. Okay, the 4 arteries forming the Kieselbach's plexus at the little's area can be remembered as GAS, G-A-S-S. Okay, fine. Now coming to the next topic of the nasal septum, that is nerve supply of the nasal septum. Okay, so just to remember the names of the 4 nerves supplying the nasal septum. Okay, olfactory nerves, anterior ethmoidal nerve, anterior superior alveolar nerve, and nasal branches of the pterygopalatine ganglion. Fine. Olfactory nerves, anterior ethmoidal nerve, anterior superior alveolar nerve, then nasal branches of pterygopalatine ganglion. Okay, so these are the 4 nerves supplying the different parts of the nasal septum. Fine. Okay, and final topic related to the nasal septum is applied aspect of the nasal septum, isn't it? Applied aspect of nasal septum. Okay, so the applied aspect of nasal septum, remember DNS. What is DNS? Deviated nasal septum. Okay, DNS is representing the deviated nasal septum. Okay, I have already told you nasal septum is almost located in the midline. It is the median partition between the 2 nasal cavities. Okay, it is almost located in the midline. But if there is gross deviation of nasal septum towards right side or left side, okay, that means away from the midline. Okay, gross deviation of nasal septum towards right or left side of the midline is called as deviated nasal septum. Okay, it may be due to trauma or it may be due to congenital anomalies. Okay, and what will be the clinical feature of the deviated nasal septum? It may cause obstruction of the nasal cavities. So it may cause nasal obstruction. Okay, obstruction to the air passage. Okay, so take care of this DNS, deviated nasal septum. That is the applied aspect of nasal septum. Okay, fine. Okay, let's move to the next Sparta's question. Any idea about the area I am marking now? What is this entire area I am marking now called as? Yes, this is the lateral wall of the nose. Okay, you are seeing here lateral wall of nose. In lateral wall of nose, one particular Miatas has been pinned in this diagram. Okay, or it may be probed. Any idea which Miatas has been probed in this specimen? Exactly, this is the inferior Miatas. Okay, inferior Miatas of nose. Okay, so the pinned structure or pinned area is called as inferior meatus of nose. So I want you to have an idea what is concave, what is meatus. Okay. So again, similar to the nasal septum, lateral wall of nose is also a important short notes question. So not only for spotters, for the theory exam also, the lateral wall of nose is important. Okay. So let me talk about the details of the lateral wall of nose. Okay. Here also, you have to know the formation of the nasal septum. So I humbly request you to go through the various bones forming the various bones forming the lateral wall of nose. Okay, so please go through the topic formation of the lateral wall of nose. What are the various bones forming the lateral wall of nose? Fine. Then now we are going to discuss, okay, the other than formation, we are going to talk about the features present in the lateral wall of the nose, followed by blood supply, nerve supply, and applied. Okay. The main topic here is features present in the lateral wall of nose. Okay. So as you see in this specimen, the lateral wall of nose contains three self-like bony projections called as concave. Okay. Conca, singular, concave is plural. Okay. Concave, otherwise called as turbinates. Okay. So how will you define concave or turbinates? They are the self-like bony projections present in the lateral wall of nose. Okay. So let me mark the three concave as number 1, number 2, and number 3. Okay. From above downwards. Okay. This is above, this is below, isn't it? So number 1 is superior concha. Number 2 is middle concha. Number 3 is inferior concha, isn't it? Okay. Now, just below the concha, we have some spaces, isn't it? Some spaces. I am marking as 1, 2, 3 again. Okay. I am marking as 1, 2, 3 here. Okay. So just below the bony projections, which are called as concha, we have some spaces or depressions called as, anybody? Miatas. Okay. So I hope you are clear about the definition of the concave, otherwise called as turbinates, and Miatas. Okay. Yes. Now, so I told you just below the concave, okay, just below the corresponding concave, we have the spaces called as Miatas. Okay. So what are the three Miatas we have? Superior meatus, middle meatus, inferior meatus. Fine. Okay. So out of these three Miatases, you know, okay, superior meatus lies below the superior concha, middle meatus lies below the middle concha, inferior meatus lies below the inferior concha, right? Okay. Now, one more important thing is, other than the three Miatases I have told you, superior, middle, and inferior Miatases, there is one more depression located just above the superior concha. Okay, one more meatus which is located just above the, okay, fine. So one more meatus which is located just above the superior concha called as sphenoethmoidal recess. Recess means depression. Okay, it is almost equivalent to the word meatus. Sphenoethmoidal recess. So how will you define sphenoethmoidal recess? Yes, it is a depression located above the superior concha. Fine. Now I hope you are clear about the various concha and meatases. Okay, I told you superior concha, middle concha, inferior concha, right? Out of these three, remember, superior concha, middle concha, both are parts of ethmoid bone. Both are parts of ethmoid bone. Fine. What about the inferior concha? Inferior concha is an independent bone. Okay, it is an independent, that means separate bone. Independent or separate bone. Which one? Inferior concha, and it is the largest concha. Out of the three concave, the largest concha is inferior concha. Fine. So take care of these things. And out of the three meatases we are seeing here, the largest meatus is inferior meatus. So inferior concha is the largest concha. Inferior meatus is the largest meatus. Fine. Okay. And some more details we have to know here. The middle meatus I told you, right? it contains two important features. One is called as bulla ethmoidalis, another one is called as hiatus semilunaris. Okay, bulla means elevation, bulge, elevation. Okay, so we have to know how the bulla ethmoidalis is produced. So it is an rounded elevation, okay, present in the middle meatus, okay, and this bulla ethmoidalis is an elevation produced by or formed by, okay, opening of middle ethmoidal air sinuses. Okay, so if you want, you can remember as BEME. BE means bulla ethmoidalis, which is an elevation present in the middle meatus produced by what? Middle ethmoidal air sinuses. Fine. Okay. Just below the bulla ethmoidalis, we have a depression called as hiatus semilunaris. Semilunar shaped depression called as hiatus semilunaris. Okay. Yes. Now coming to I hope you are clear about the concave and meatasis, right? Now let me talk about the openings present in the lateral wall of the nose. Okay, openings present in the lateral wall of nose. Okay, so I told you there is sphenoethmoidal recess, then superior, middle, and inferior meatus, right? So sphenoethmoidal recess, which is a depression just above the superior concha, receives the opening of sphenoidal air sinuses. Okay, remember, sphenoidal air sinuses open into sphenoethmoidal recess. Fine. What about the superior meatus? In the superior, the word you have PE, isn't it? So you can easily remember superior meatus is the site of opening of what? PE, posterior ethmoidal air sinuses. Posterior ethmoidal air sinuses. Fine. Now coming to the middle meatus, I have told you already, the middle meatus contains two important features. It contains one rounded elevation called as bulla ethmoidalis, BEME, which is produced by the opening of middle ethmoidal air sinuses, right? Okay. Then just below the bulla ethmoidalis, we have hiatus semilunaris, okay, which receives the opening of remaining all the paranasal sinuses, namely frontal air sinus, anterior ethmoidal air sinus, and maxillary sinus. Fine. Okay. Now there is one more meatus, isn't it? Below the inferior concha, called as inferior meatus. Remember, no paranasal sinuses are opening into the inferior meatus, but inferior meatus receives one structure, namely nasolacrimal duct. Okay, very important MCQ question. Nasolacrimal duct opens into the following meatus of the nose. The answer is inferior meatus. Okay. So middle meatus receives the openings of various paranasal sinuses, right? For example, if you want, you can remember as fame. Okay, fame. Okay, fame. So what are the various paranasal sinuses opening into the middle meatus? Frontal air sinus. Fine. Then anterior ethmoidal air sinus. Anterior ethmoidal air sinus. Then middle ethmoidal air sinus, then maxillary air sinus. Okay, all are opening into the middle meatus. Okay, and I hope you know the site of opening of sphenoidal air sinus and posterior ethmoidal air sinuses. Fine. Yes. So this is the diagram showing the three concave: superior concha, middle concha, inferior concha, isn't it? Below the various concave, we have the superior meatus, middle meatus, inferior meatus, and you know the various structures opening into the various meatuses, isn't it? Okay. And I told you already, sphenoidal air sinus opens into one depression called as sphenoethmoidal recess. Okay, sphenoethmoidal recess receives the opening of sphenoidal air sinuses. Fine. Okay. Then what about the nerve supply and blood supply of the lateral wall of nose? It is almost similar to the blood supply and nerve supply of nasal septum. So I humbly request you to go through the topic we have discussed already. Okay. So the nerve supply and the blood supply of the nasal septum as well as lateral wall of nose is almost similar. Okay, fine. Now coming to the applied aspect of the lateral wall of nose, you can simply remember rhinitis. Rhinitis. Okay. So you know the meaning of itis, that is inflammation. Okay. So inflammation of the inflammation of mucous membrane or mucosa of nasal cavity is called as rhinitis. Okay. Otherwise, we can say as running nose. Okay. So rhinitis is the inflammation of mucosa or mucous membrane of the nasal cavity or cavities. Okay, which will lead to obstruction of the nose, sneezing. Okay, etc. Fine. Now coming to the last Spartus question. Any idea about the structure pinned or probed here? Yes, the probed structure is sphenoidal air sinus. Sphenoidal sinus or sphenoidal air sinus. Okay, and the possible subquestion for the sphenoidal air sinus is, what is the site of opening of the probed space? What is the site of opening of sphenoidal air sinus? Just now we have discussed in the previous slide. Yes, sphenoidal air sinuses open into the sphenoethmoidal recess. Okay, sphenoidal air sinuses open into the sphenoethmoidal recess. Sphenoethmoidal recess. Fine. Okay. Okay, fine. Then another one possible subquestion for the sphenoidal air sinuses is, what is the superior relation? Okay, what is the superior relation of the, what is the location or what is the superior relation of the sphenoidal air sinus? What is the location of sphenoidal air sinus? Exactly, it is located within the, it is located within the body of sphenoid bone. Okay, it is located within the body of sphenoid bone. That's why it is called a sphenoidal air sinus. Okay, body of sphenoid bone, within the body of sphenoid bone. Fine. And if the superior relation is asked, you will be knowing just above the body of sphenoid bone we have a depression, the one I am marking now. Okay, what is the name of the depression present in the body of sphenoid bone? Exactly, it is called as pituitary fossa. Okay, pituitary fossa, otherwise called as hypophyseal fossa. Okay, so the superior relation for the body of the sphenoid bone is pituitary fossa, which contains what? Pituitary gland. Okay, pituitary fossa containing the pituitary gland, otherwise called as hypophysis cerebri. Hypophysis cerebri, it is the another name for the pituitary gland. Okay, fine. And one more thing, very rarely they may, very rarely they may label, they may pin this particular area. Okay, actually what I am tracing now is vertebral column, isn't it? This is the vertebral column, isn't it? So in the vertebral column, in between the bodies of adjacent vertebrae, we have particular part called as intervertebral disc. Okay, IV disc, simply called as IV disc, intervertebral disc, IV disc. Okay, so intervertebral disc is located between the bodies of adjacent vertebra. Fine. And the subquestion, the subquestion for the intervertebral disc, subquestion for the intervertebral disc may be, what are the two parts or two components of intervertebral disc? Otherwise it is made up of what type of cartilage? Okay, any one may be subquestion. So remember, what are the two parts of the intervertebral disc? Anybody? Yes, the outer part of the intervertebral disc is called as annulus fibrosus. Okay, it contains outer part called as annulus fibrosus and the inner part called as nucleus pulposus. Okay, so it contains outer annulus fibrosus and the inner nucleus pulposus. Okay, and one more important MCQ question, this nucleus pulposus is a remnant of one embryonic structure called as, yes, notochord. Okay, it is a remnant of notochord, which is an embryonic structure. Okay, nucleus pulposus is a remnant of notochord, embryonic structure called as notochord. Okay, and finally coming to the another possible subquestion for the intervertebral disc, it is made up of which type of cartilage? Okay, any idea? Is it made up of hyaline or elastic or fibro cartilage? Exactly. The intervertebral disc is made up of fibrocartilage. It is made up of fibrocartilage. Okay. And if the question is what type of cartilage, sorry, what type of joint is intervertebral disc, what should be your answer? All the midline joints, okay, all the midline joints are example for secondary cartilaginous joints. Secondary cartilaginous joints which are composed of fibrocartilage. Secondary cartilaginous joints, otherwise we can use the term symphysis. Okay, fine. So that's the end of the today's session. Thank you all. Thank you.